We're an open, not-for-profit organization, an industry alliance focused really on one key concept, which is that the data should follow the patient regardless of where care occurs. And we believe that the access to the data around that patient should be built into the workflows that physicians, social workers, nurses, anybody who's in the business of taking care of the patient, including the patient themselves, has access to. So whether it's the EHR, or whether it's the other HIT system, or the app, or the patient portal, or the lab system, or the pharmacy system, whatever that system is, the access to the data for that patient, from no matter where else that patient has been, should be available there in that system for them. Our 40+ members, who are primarily vendors of HIT systems, are driving the alliance towards adoption of the services that enable data to follow the patient regardless of where the care occurs. This last year has been probably our most exciting phase so far, which is that we went live in more than 4,400 locations all across the country, all 50 states, DC and Puerto Rico. It's really our opening thrust of a long deployment cycle as we continue improving, adding thousands and thousands of more sites over the coming years. But we started out over this past year and really made a hard push. 4,400 sites is something to be very happy about, and we're not done yet. Now, as we look forward, even as we add more sites, from the beginning, it has been, again, being across the care continuum, and our current 4,400 sites are primarily hospitals and ambulatory clinics. A couple of weeks ago, we announced we're going live this year in post-acute care settings too, long-term facilities and home health facilities. And we are going to keep going live in other use case settings as well, in other care, what we call care settings, such as at the patient portal, the imaging vendor, the lab, the pharmacy, etc. That's what we're continuing to push forward for as you look now towards 2016 as we start our 4th year of existence. So we've had a fantastic kind of upswings as, from the moment we launched 3 years ago. Right? There are 3 commitments as part of that pledge. One is that the patient should be at the center of their care. 2, that nobody should be participating in blocking of information for the purpose of care of patients. And 3, that we should all be utilizing standards such that we can enable interoperability broad-based across the country. All 3 of those principles are very much in line with what CommonWell is trying to accomplish in terms of enabling patient-centric care everywhere and making that ubiquitous. So we signed up to it because it completely made sense, and we've already made tremendous progress along all 3 of those dimensions, and we share with ONC and put up on their site what it is that we've done to enable that. My hope is that more and more organizations will realize that that is the place our nation has to go, and that's the impact that's created. What the actual impact is, of course, it's very TBD. It's an ONC initiative. We're just signing on as an alliance who believes that that's the right thing for our alliance to accomplish as well. There's been a lot of work on interoperability really over the last 32 years of the healthcare industry, ever since some of the first important standards bodies were founded. But we're getting to the place now where saying you're interoperable is just not enough anymore. It's really not going to jive with the reality which is that right now you have to be able to actually interoperate. You have to be able to get the data for the patient. There's nothing like, we have a particular set of standards we use and nothing else. There's no excuse behind which anybody should be hiding. It's time now for us to actually be exchanging data. And